Thank you, Honourable Speaker. One of the largest studies to date suggests that vaccination against the painful blistering rash caused by shingles virus could significantly reduce the risk of people developing dementia. Given this new groundbreaking information, who has the government since consulted with to provide Manitobans assurance that they are taking this new information into account?
The Honourable Minister of Health, Seniors and Long-Term Care.
Thank you, Honourable Speaker. I thank the member for Tyndall Park for that really important question. Like that member and many other folks, saw that study, the summary of that study was released. It's pretty interesting and really important data for us to assess here in Manitoba. I know that other jurisdictions are also taking a look at that research and getting a better understanding of how one treatment may impact the disease pathways of others. So this is a really important area that our government is taking a look at, and we've got our officials evaluating that research. And we look forward to also seeing what other jurisdictions learn as they do their own investigating into this research as well.
Right on.
The Honourable Member for Tyndall Park on a supplementary question.
Thank you, Honourable Speaker. Currently, over 20,000 Manitobans have been diagnosed with dementia, and this number is growing rapidly. It's expected to double by 2050. What this means is the shingles vaccine not only prevents Manitobans from contracting a painful disease, but could also prevent up to 8,000 Manitobans from developing dementia. Does the government recognize the urgency to roll out these vaccinations sooner rather than later?
The Honourable Minister of Health, Seniors and Long-Term Care.
Again, really appreciate that important question from the member for Tyndall Park. Our government is and has directed, I have directed our officials to take a look at this study and this research. Certainly we recognize that more and more Manitobans are affected by dementia. I think there's probably many of us in this chamber who have some sort of connection to that disease and understand how it affects families and whole communities. On this side of the House, we're taking steps to strengthen the services for families and those who rely on that kind of health care and the supports that are available in our province. For 7.5 years, the previous PC government did nothing to make sure that Manitobans and their families who need access to these services would have them. Our government's taking a different approach, and our government believes in science, so we'll be taking a look at that data as well.
Time is expired. The Honourable Member for Tyndall Park on a final supplementary question.
Thank you, Honourable Speaker. Our province does not track the number of people who have obtained the shingles vaccine at their own expense. We do not track the number of people who are hospitalized with shingles, and we do not begin the complicated process of diagnosing for dementia until after a person begins to display symptoms. Will the minister commit to begin tracking these statistics to ensure the best quality of care for Manitobans?
The Honourable Minister of Health, Seniors and Long-Term Care.
I think that's a really interesting question. I really do, and I think it's something that I can take away from that member and take some looking at. I think it's important. I will say that specific to diagnosing dementia, the ways in which folks can get that diagnosis, the understanding of how symptoms present can be quite complex, can be very nuanced, and so I think that area in particular might take a bit more digging into to better understand the options there. But I do want to note that the member for Lakabani started heckling before he even stood up to answer the question. And I think it shows, Honourable Speaker, the lack of seriousness on that side of the House, the lack of seriousness from the Leader of the Opposition when it comes to healthcare issues that affect Manitobans. And it's really disheartening to see that 7.5 years that member cut healthcare and didn't treat families with respect, and he continues to do that even in opposition.
First time is